Hi friends, Wade Baskin here, Doctor of Physical Therapy, and I'm excited to talk to you today simply because I have an issue that I've just got to get off my chest, and it is that you are in pain and you don't have to be. I cannot tell you how tired I am of seeing people come in my clinic that have been treated and treated and treated, especially by other physical therapists or by other practitioners for however long, and there are no results, and then we treat them in 1 or 2 or 3 sessions, and they're 50% or more better. I'm not saying that what we're doing is, that much more grandiose than what others are doing, but I'm just saying that, my goodness, people, come on. If you're in the arts and sciences of treating people and getting them better, helping them with pain, let's not run businesses to get people in like cattle, run them through a chute, and build procedures. Let's get them in and actually work to get rid of their problem that's causing that pain. Take an authentic interest in that person and fix them and help them use your procedures in a way that is designed to help the patient get better, so they in turn go tell others, and then those others want to come to your business. That is the American way. You provide a service that is valuable and it works. Okay? Does our approach work on everybody? No, absolutely not. Does it work on most people? Absolutely. We've been in business for 20 years and we're not going anywhere, and we're expanding. Our model is very popular. Okay? There's a period of time there where a lot of politics have taken place or were taking place where it didn't matter how good of a therapist you are. And it's still, there are still some situations where it doesn't matter how good you are. If you know the right people and you're connected well, set up a clinic next to an orthopedic doctor and they're doing surgery and you're doing rehab kind of activity. All right, you can run a practice night and day and night and just blow the dollars away. It can be very lucrative for a therapist. But our body of knowledge in physical therapy lends us to being able to do so much good work for people that if you find that physical therapist who's willing to take that knowledge and apply it in a way that is uniquely for you, then that is the best physical therapist you can find right there. That's going to be the best physical therapy you get. Physical therapists are trained in so much stuff. The training is much more than any acupuncturist, of course, or any chiropractor. It's vast. We're not trained as physicians. Absolutely not. We're specialists in neuromusculoskeletal treatment of physical dysfunction and movement problems. Okay, that's basically what we do. We treat people that have problems with movement, structural movement problems, pain that are from physical sources there. So and honestly, most physical therapists that I know, that I'm around, especially in my area, tend to take that what we call easy way out. They work a job, and then when the patient comes in, they're doing procedures or giving exercises or things like that for that given body part that hurts. Is it specific to the patient's problem? For the most part, I guess it must be. No one's getting thrown in jail per se. But today is just one of those days where you see someone come in and you hear the treatment they went through, and I'm wondering, what does it take? What does it take for a therapist to take a few extra hours, a vested interest in what they do, and really learn some innovative things that help, some evidence-based things that help? Okay? Can you see I'm a little fired up? I love what our profession can do for people. And I guess I know I shouldn't expect everybody to be like us. At GT Physical Therapy, it's not like we work a job. It's just what we do. We have a passion for helping people move better, feel better, get out of pain, get back to living life fast and in a pain-free way. We don't put people through pain. Even with a total knee replacement, people come through and they're like, I thought this was going to hurt. People that have been in pain for 15 years, they come in and, oh, wow, it's been 15 years, and how'd you get rid of it? It's only been a few sessions. Or in one day, they walk out and like, wait a minute, that's been hurting for, I can't remember when it wasn't hurting, and now it doesn't, and I can move my neck all the way to the right. When I back out, I can turn my head this way. My headache is essentially gone. How did you do that? You just touched a few little things. We're not doing anything magic, people. We're just studying, we're researching, and we're practicing. And when people come in, we provide the absolute best. And yes, we're specialists and we're higher trained than most physical therapists. But you know what? Physical therapy is that. It's just physical therapy. I mean, we should be charging, $250 for that kind of treatment. I'm sorry, it just doesn't happen that way. You can pay 150 bucks for a session at a hospital, at another practice, at my place, and guess what? It all costs the same, but it's not the same. When you pay that dollar, what are you really getting? When you pay that dollar at my practice, you're getting over and above the value of that dollar. I can tell you that. When you go to other places, are you willing to be in pain and be hurting and need a service and take money out of your pocket and lay it down on the table right there saying, okay, I need you to treat me. And then they put you through a painful regimen of stuff and it doesn't get better and you keep hurting. And 2 weeks later, are you still going to be paying out of your pocket to get that service? Or would you be willing to pay for a service where you're hurting, something's not working right in your body, and then you walk out and you already feel better and you can move better and it didn't hurt? Yeah, that's pretty dang valuable. And that's the way I've designed our protocols and practices at GT Physical Therapy. And I love it. I'm tired of people not practicing some of the best practices that are out there. I'm tired of people staying in the 1970s. Some people are still using ultrasound, waving the magic wand on people thinking that's going to be something really good. And they bill the patient for it. And that's ridiculous. My mother-in-law got billed $50 for a hot pack that I hate to say it, as a physical therapist, put in a microwave and brought it out there, put it on and charged $50. And she's Medicare, so of course she had to end up paying for. Oh my goodness! Look, let's get down to it. We love helping people. Love helping those who have real problems, need to get better, don't have time for therapy, don't have time to go through 12 weeks of whatever to get better. I mean, let's get it done faster. Why not feel better on the first session? Why not know and have confidence on that first session without pain that you are on the right path? That's worth it. I cannot tell you one patient that has not come through our doors that said that they would not be willing to pay for that out of pocket. And that's one of our biggest compliments right there. Just to go to therapy is not just going to therapy. You should go to therapy with a desire to get better and knowing that you're going to get better. And you should have confidence that you're going to get better. And your therapist should be telling you exactly what they're going to do, how they're going to do it, what you should be feeling, where you should be at what point in time. And if not, then you need to find another therapist. I'll tell you that straight up. Okay, I love what we do. Our profession can do so much for people. But does that mean all physical therapy is the same? It's not. And unfortunately, you have to look and search and find and use word of mouth. Call. I can tell you this one thing. If your physical therapist is not a manual trained physical therapist, your results will not be as good as if you go to a therapist who's had manual therapy training. Okay? I can tell you that's basic. That's research. That's evidence. We know that. And of course, use your friends. And if you want to find the best therapist in your area, give me a call. Give my office a call. The link is below. Our number's below. We'll find a suitable physical therapist in your area that can take the best care of you possible. We'll do our best to do that, okay? We keep a database of all good physical therapists out there that have had unique and advanced training, okay? I don't care if they're board certified in the 7 different areas that they can board certify in. I don't care how many degrees they have. Let's talk results. Do they care about what they do? Or do they get results with their patients? Do they have a great reputation? Okay, that's what matters. I've seen physical therapists with this many degrees right here, and they haven't touched a patient in I don't know how long. Yeah, I have a few degrees. I have a lot of credentials, but you know what? I still love treating people. I love teaching my staff how to do it. I love watching people walk in my clinic in pain and walk out with a smile, not in pain or not in near as much pain, and they know something good has happened. And there's no side effects. They're not going to die because we're not prescribing drugs. We're not doing surgery. Okay? It's pretty awesome stuff. I love what we do. We can help people. I want the word to spread. I'm tired of seeing people hurting unnecessarily. I'm tired of seeing people limp unnecessarily. I'm tired of seeing people with a disability when they have so much more ability. It just needs to be unlocked and released. And we have the procedures, and many times we have the answers to help that happen. I don't care what kind of treatment you've had, if you've had injections, if you've had surgery that's failed, if you've had other physical therapy, chiropractic, acupuncture, any other kind of hands-on manual therapy, massage therapy, whatever, you name it. I don't care what you've had. If it's not working out, you should give us a try. Let us see if we can help, because many times we can unlock something to where, guess what? That injection works. The massage therapy now feels good and it doesn't kill you. You can now exercise and the next day you're not in bed recovering. Okay, sometimes all it takes is just a little something, but that little something has to be found by someone qualified in examination in order to do that. the right kind of examination, and then the procedure to unlock the body's potential to heal in that area. That's what we do. I'm Wade Baskin, Doctor of Physical Therapy. I look forward to hearing of your success. And if we can help you in any way, please give us a call. I'm out.